welcome to the Honours for Nutrition and Rural Health seminar. We're going to go through a quick summary of what Honours with the Department of Nutrition, Food, Dietetics and Food, and what also Rural Health will be about. So why do Honours is a really important question when you're thinking about doing an extra year of study at uni. It's a really important year which helps you develop your research skills and competencies, and it can really develop great skills that can be used across different jobs, and they're very transferable for different avenues and graduate positions. And what's really important, I guess, is you get a really deep understanding of some key aspects from our perspective from human nutrition, but also just that understanding of how to evaluate, how to really summarize and look at some good research techniques, and just a better understanding of how to interpret some of the real medical and research publication information and knowledge. And it just gives you that deeper understanding, I guess, in a particular area that hopefully you're passionate in. So within the actual honours, and well, I don't want to go too much today, but there are a few little components and assessment pieces that we do to really build up your knowledge and skills where you might have had these in your undergrad. So we're looking at things like biomedical statistics. If there's a good component that really supports you and develops your understanding of what's needed to work in research. There's the literature review on your actual project topic and the actual thesis. And there's a couple of other little components that are also included. But all the reasons for including the assessment is purely to really develop your skills and help you develop into a well-rounded researcher. So for the area of nutrition, what's really important is we've got 4 areas, and I've got 3 that we've got some fantastic topics that are going to be discussed today. And the thing when you're thinking about honours is it's got to be something you're interested and passionate in. And the main thing is, and the reason why I've got some fantastic people online today, is really to make sure that you get that organising and understand the different areas that the supervisors themselves actually work in. You know, this is their area of expertise. And the actual research environment where you do it here at Monash is a fantastic opportunity, I guess, to work within the department. The first area when we wanted to talk about for nutrition is actually metabolism. And I'd just like to get a quick summary from Nicole, please, on this area of research.
Thanks, Megan. Hi, everyone. My name's Nicole Kellow, and I'm one of the coordinators of the nutrition metabolism theme. And as you can see, that theme is trying to explore how dietary patterns and particular nutrients influence cellular and physiological processes associated with chronic disease development. So we look at all types of chronic disease in our department: obesity, cardiovascular disease, diabetes, dementia, cancer, and so on. So we've got some topics here, particularly from 2 colleagues of mine within the theme who are interested in exploring the effect of time-restricted eating on shift workers, and also on the relationship between diet and cognition and development of dementia. So I just want to highlight those projects. So, you know, just by turning up to work, about 20% of our working age population are putting their health at risk because they're night shift workers, and people who work at night, their internal body clock is out of sync with with the way that our body was actually designed to sleep at night and during the day eat and digest nutrients. Now, when that pattern is reversed, our circadian rhythm, or our body clock, becomes misaligned. And so we've just completed a large multi-site randomised controlled trial looking at the effect of restricting energy intake at night in shift workers. It was a 3-arm trial, and it's just been completed. It was an 18-month study. And so Professor Maxine Bonham has, that's actually supposed to be Bonham, B-O-N-H-A-M instead of Donham. She's got 3 projects there which will give students a lot of experience in looking at a large data set of results and looking at different types of analysis and looking at different types of research questions to try and ascertain what is the best type of dietary pattern to follow to enhance the optimal health of people who work at night. And Barbara Cardoso, another colleague, has a great interest in the development of cognitive dysfunction and dementia with ageing, and how dietary patterns and individual nutrients might affect our ability to maintain good cognition as we age. So thank you.
Thank you so much, Nicole. And I'd now like to hand over to Jess, who has got some fantastic honours projects up in the area of clinical nutrition research. Thank you, Jess.
Thank you, and hi everybody. So the clinical nutrition research theme, all of our research themes slightly overlap with each other. We have, although you can see my name on the screen here, the aims outline just how many different types of projects, different types of disease settings, patient cohorts our colleagues work with. So overall, our clinical nutrition research, what we're aiming to do is really generate this high quality evidence that explores novel research questions applying to the broad range of clinical practice. We're aiming to benefit patients, clinicians, health services, and of course, informing future research. Some of the projects that we have are in really close collaboration with particularly clinical partners. These could be specialists of varying disciplines. I myself work closely with a lot of gastroenterologists or dietitians who specialize in gastroenterology, microbiologists, endocrinologists, whatever the endpoint is. Our studies within this theme are often also in close collaboration with clinical sites, whether these are clinical practices or hospitals. So just by way of doing some of these projects, it means that you get an opportunity to network and collaborate with different people, an important opportunity to network for your future careers. Aside from the projects that I've got listed, which you can see are all related somewhat to gastroenterology and how we can use diet to sort of manage gut symptoms, we do have other projects available. They're all looking at diet-disease relationships, and I would encourage anybody that's interested in a future research career or a future career that overlaps with anything, or you have an interest in clinical nutrition, to come and have a chat to any one of us and have a chat about projects and what research and some career doors could open for you. Thanks.
Thank you so much, Jess. And the last area we wanted to just highlight today is the public health nutrition theme. I'll be happy to hand over to Julie.
So I'm Julie Brimblecombe. I'm Associate Professor of Public Health Nutrition in the Department of Nutrition, Dietetics and Food. Public health nutrition, it's really looking at population nutrition, but it's got a particular focus on the determinants of nutrition and diet. So it does work a little bit upstream. We're very interested in looking at food environments, food systems, food security, and what some of the policy determinants are of those particular types of environments and systems. Within our public health nutrition theme, we've got projects happening within indigenous food systems. So a lot of the research I do, for example, has got a focus on addressing food and nutrition inequities with remote communities, so Aboriginal and Torres Strait Islander communities, particularly here in the Northern Territory. We certainly take real-world systems approaches to improving population-level nutrition. We're often looking to see what's causing some of the issues, or what are the issues in the first place, what's causing some of those issues, but how can we actually address those and then translate those findings into practice and policy. So I talked about addressing social inequities, modifying food environments. We've got a lot of our research is looking at food environments within the food retail setting, so university settings as well as remote community settings, urban supermarket settings, etc. This is where, for a lot of people in Australia and globally, people purchase and consume most of their food from that type of retail context. WHO in their plan to prevent non-communicable diseases, which continue to be on the rise, certainly talk about putting policies in place to try to transform or shift food retail environments to be healthier. We also look at capacity building. So obviously to have strong public health nutrition and healthy population diets, we need to have a workforce who can work with all of the different stakeholders and different settings. So a lot of our work really focuses on trying to equip and build that workforce with the tools, with the know-how for them to be able to be agents of change. I've got two specific projects here, and then I'll hand over to Sue as well. One is this first project, evaluation of a food labelling initiative in a remote community context, would be working very closely with a large store group in the Northern Territory. So it would certainly give you opportunity to experience a different context. You would have to spend some time here in remote Australia, but it would be looking at, there would be some literature review about the Health Start rating, for example, and then looking at what other types of labelling systems might be appropriate for this context. We're very interested, like I said before, in looking at social determinants, but also commercial determinants. And so within the context of remote stores, what is the role and power of the beverage industry? And what are some things that we might be able to do to keep them accountable to the types of practice that they might be communicating that they're supporting? So, Sue, I'll hand over to you.
Julie. Hi, everyone. So my name's Sue Kleve. My research area is in household and community food security. So food security, I guess, quite simply is really whether people have a regular and reliable physical, social and economic access to food that meets their cultural preferences, their daily needs, their dietary needs for a healthy and active life. So the couple of projects that we have available here in this realm, one of the core determinants of food security is certainly monetary related. So the first project there is really wanting to look at the cost of food, and particularly for people on special diets. So those who experience either gluten intolerance or celiac disease are required to eat a very specific diet, which we know is much more expensive than the regular diet or the habitual Australian diet. So this will be exploring doing some collection within supermarket settings, within store settings, to look at the cost of foods using a validated nationwide tool, and to then explore the comparisons across the cost, what it means for people, because it is significantly more expensive, but there's not really a lot of work in Australia in this area. The other area is, I think we know, we've heard a lot around cost of living pressures. One of the fallouts of that is people being able to put food on the table and relying increasingly so on emergency food relief or food relief. The second project really wants to really understand or explore within the food relief landscape within Victoria, how are those organisations aiming to meet sort of support with the food they provide cultural preferences and also meet special dietary needs. So that will be some scoping out and doing some interviews with a whole range of food relief providers. And that's it for me. Thanks.
Thank you so much. So that is all the projects currently really that we want to focus on and discuss today. What's really important though is, and I guess this is where you've got a moment, but if you're interested in doing a project, the requirement is a distinction overall, total of 24 points from your 30 units for R6 in nutrition, and just to really think about the fact that the deadline is the 17th of November. So I'd like to now hand over to David, and who'd like to speak about the area for rural health. Thank you.
Thanks, Megan, and thanks everybody from nutrition. My name is David Reeser. I'm the honors coordinator for the Monash Rural Health School, which covers essentially all of Victoria. We have a wide variety of projects available, everything from clinical medicine through to improving the workforce and attracting health professionals to work in rural communities, to the effects of climate change on healthcare delivery and what it might mean for both practicing doctors and nurses, as well as patients and people who may become patients in the future. All of those projects are at the various sites across Victoria where we work, which go all the way from Mildura to Sale and Bairnsdale. So there are a lot of opportunities both to work at the major Monash campuses, but also at various medical sites and rural and remote sites around Victoria. I think the range of projects is probably too broad to cover in detail. They are available on Supervisor Connect, as well as if you're interested in one or more of them, I'm more than happy to make an appointment and discuss them with you, or to connect you with the various investigators. I think the main point that probably is most relevant for people thinking about doing BMS honors is we are also the site that runs the graduate entry medical program. So there are a lot of opportunities to look at projects that are related not just to medicine and healthcare delivery, but also to medical, as well as nursing and allied health education. And those are areas that sometimes people may not be aware of, but have a lot of relevance for the kinds of research that many of the students coming up through the undergraduate pathways are interested in pursuing. Greg has asked the question in general, what our honor students have gone on to do in their careers. From the rural health point of view, I can tell you we've had a number of students who've been successful in getting entry to the graduate medicine program. We've also had quite a few who've gone on to jobs in industry and policy, and we've had several who've gone on to do PhDs within Monash Rural Health. So that pretty much is the case for us, and probably for, I'll let Megan speak for nutrition, but we have quite a lot of opportunities available to honors graduates, and our track record so far has been that they've done quite well.
I would second that with for our students in nutrition. We've got last year's current students going to do a PhD. Many that is one of the pathways that you can get through honours, is that it opens up that research into the PhD. And we've had other students who it's just been a really good stepping stone to get them into a particular area where they've gone and worked in that particular field. But I'd like to thank all my nutrition colleagues for their time, and if I have any questions that relate to them, I'll make sure that they know.
Thanks, everybody.